Hello, everyone. It's Dr. Nirav Pandya. A lot of 49ers fans have questions about how the amount of throwing that Brock Purdy is doing is being managed as we begin the season. Here's a quick breakdown of the general principles of how we actually manage athletes after they get reconstructive surgery in a joint in general, what the various factors that are going to determine progression, and how we reintegrate athletes into sport. Now, when we look globally at how we return athletes back to sport, there are basically three main phases in my eyes. There's the biological healing, there's functional healing, and then there's reintegration into sport. Now, a lot of these phases occur concurrently, but sometimes one phase takes precedent over another. Now, biological healing is really, really simple to understand. That's when the injured tissue is actually healed from a structural standpoint. So when a ligament is basically torn, when is that ligament healed together and able to perform what it needs to do? Then there's functional healing, which is basically even when biological healing is taking place, when motion comes back in the joint, when you get strength back, when pain and swelling are controlled. Now, a lot of times this takes place concurrently. While something is biological healing, when a ligament is coming together, you can still work on things like mobility and strength so athletes can return to play quicker. Now, once you've got functional healing and biological healing, that's when reintegration into sport occurs. Now, it's important to understand that when athletes start going back into sports, their ligament likely is healed and they've gotten back their strength and mobility. But because an athlete has taken a period of time off, you need to make sure that you're ramping them up slowly so that that area doesn't get sore or that ligament or whatever structure has been had an operation on doesn't get injured again. So a lot of times when an athlete's going back, just because you're managing how much they may be throwing or how much they're running, it's not necessarily because they're not quote unquote healed, but because you're getting their body ready for optimal performance. So a lot of times what can happen, particularly when athletes are reintegrating into sport, sometimes you can get normal muscle soreness. So you're adapting how much they may be running or throwing. Sometimes they may not even necessarily be having soreness, but what you're doing is trying to optimize their performance, which means decreasing or changing the load before they have a competition or a game. It's also important to understand that for a regular athlete who doesn't get injured, they have 5 to 6 months to get themselves ready for a season based on whatever sport they're playing. For an athlete who's undergoing surgery, a good portion of that time is basically working on biological healing. It's working on functional healing, and they're not necessarily training. So even though they may quote unquote be cleared to go back to an activity, they may not be necessarily to take on that intensity of activity, or you need to slowly ramp up how much they're doing so their body can get ready. Can't expect one athlete who's had 6 months to train without an injury to basically be at the same level as an athlete who may have spent part of their time rehabbing and then get them back to performing at an elite level. There's going to be some management of load along that way to make sure that they're ready to play. And those first several months may have episodes where load is decreased, where some soreness may develop, which is a normal part of the healing process. It's the purpose and the job of the medical staff to determine what soreness and what symptoms are problematic and what are just normal part of the reintegration process. Thank you.